Fat transfer is usually done to patients who want their excess fat to be removed from other parts of their body and to be injected in areas where it is necessary. These areas include the breast tissue, face, and buttocks. The areas where we take fat from are usually the abdominal area, the flanks, and the thighs. The fat is taken with liposuction and injected with very small cannulas, and the scars of these cannulas are usually a few millimeters and they usually become almost invisible in time. Fat transfer to the face can be done to the temporal area, under the eyebrows, to the under eye area, to the cheeks, chin, upper part of the nose, forehead, and nasolabial folds, and also it can be used for lip augmentation at the same time. Fat transfer to the breast is possible, and it also rejuvenates the breast, but it does not cause a size upgrade in the breast, which means a B cup breast does not become a C cup. Fat transfer to the breast is usually used in combination with breast augmentation to increase the soft tissue in the décolleté area or the medial part of the breast, or sometimes even the lower part of the breast if the patient has a tubular breast. It can be used in breast reconstruction patients to be able to make a more uniform and thicker skin around the implant that has been thinned due to the mastectomy procedure itself. There is usually swelling in the donor areas where the fat is taken from, and there can be some swelling and also some ecchymosis in the areas where fat is transferred. This is especially true in the under eye area, sometimes in the breast. It also depends on whether we have done any scoring in the breast tissue, especially in tubular breast patients. The patients need to wear a corset after surgery, and this corset may extend from below the knee level to the upper waist level, depending on where the fat has been taken from. We also advise a soft but compressive bra to the breast if the patient has had fat transfer to the breast tissue. For the face, we do not have any corsets, but if the patient has had a combination surgery, especially a liposuction of the neck area, then a different type of corset may be necessary postoperatively. But application of ice is very relieving, both for the pain and also it subsides the edema much quicker compared to patients who do not use any ice after their surgery. Fat transfer can also be done for buttock augmentation, and this procedure is called the Brazilian butt surgery. It usually takes between 3 to 5 hours, and the patients usually need to wear a corset after surgery depending on where fat has been taken from. In any fat transfer, the amount of fat that is given to an area is never the same 3 months after surgery. We usually inform the patients that after the fat transfer, about 20 to 40% of the fat that is transferred will stay, and the rest of the 60 to 80% of the fat is going to be absorbed by the body itself. What is left after 3 months is going to be the patient's own fat in the area where it is transferred. The fat tissue contains stem cells. These stem cells rejuvenate the skin as well as augmenting the area where they are transferred. So it is especially used in the facial rejuvenation surgery and neck rejuvenation surgery. The skin also is rejuvenated as well as having a soft tissue augmentation in any kind of combination facial surgery.